We've been told to avoid people who are obviously sick, coughing, and sneezing to prevent us from getting the new coronavirus. But up to 25% of people infected may never have symptoms. And in others, the symptoms may not show up until 48 hours after being infected, according to new evidence. Yet researchers have said people in both groups may be silent spreaders of the virus. Several recent studies have backed this up. One that studied transmission in Singapore and China found infection was transmitted between 2.55 and 2.89 days, respectively, before symptoms started. Another that identified 7 clusters of COVID-19 cases in which transmission likely occurred before symptoms found that 6.4% of cases were attributed to transmission before there were symptoms. Another study in China found that 12.6% of the transmissions could have occurred before symptoms began in the source patient. The initial epidemiologic research suggests that asymptomatic spreading is happening, so how exactly is the virus being spread? People think, if I don't feel bad, I don't have it and can't give it to anyone, and that is now misguided thinking. Researchers don't yet have all the answers. But an expert panel from the National Academy of Sciences told White House officials Wednesday night that the virus can possibly be spread through talking or just breathing. Currently available research supports the possibility that SARS-CoV-2 could be spread via bioaerosols generated directly by patients' exhalation. Or touching your eyes, little things like touching your nose then touching a doorknob or other common surface, that can help spread it, or clearing your throat. If you have a large number of people doing little things, that's a problem. Speech, singing may spread the virus. After a person is exposed, the virus is propagating in your body, but your immune system has not recognized that something is going on systemically. That's why you don't get a fever right away. Just because you don't have symptoms doesn't mean you don't have the virus. The Singapore researchers say the spread of the virus before there are symptoms might happen through generation of respiratory droplets or possibly through indirect transmission. Speech and other vocal activities such as singing have been shown to generate air particles, with the rate of emission corresponding to voice loudness. They cite the report about singers in Washington state attending choir practice, with 40 of 60 later testing positive for the virus. Basically, the infection is transmitted from the silent spreaders the same ways obviously sick people do. If someone sneezes or coughs and wipe their nose, and those droplets get on you or your hands and you touch your face, that's thought to be the most common route of transmission at the moment. Although the virus shed on surfaces can also be infectious. People who have mild symptoms may pass it off as allergies or a slight cold. Taking precautions. The CDC says that people are thought to be the most contagious when they are symptomatic, or sickest. But as more information emerges about how the virus spreads, more people are taking to wearing masks. Evidence of transmission by silent spreaders reinforces the importance of measures already in place, experts agree. That means continuing to use social distancing, frequent hand washing, and disinfecting household surfaces.
Thanks for watching. Subscribe our channel for latest video.